Okay, so pelvic floor physical therapy has been becoming more popular, and we think this is great. Y'all know we're big advocates. We like to help educate on this thing that not a lot of people know about. And still, even though it's becoming more popular, not a lot of us understand what this branch of physical therapy really entails, or how to find a physical therapist who's really equipped to treat us as we need. And also, Emily and I have heard from a lot of women, or a few women, when we were recording our original podcasts on pelvic floor physical therapy, that a lot of women had questions because they didn't feel like they were getting better. And now I know in my own personal experience, it does for some diagnoses or some situations, it can take a while to heal, but we want to make sure that women are confident that they are seeing a pelvic floor physical therapist who is equipped to treat what they're being treated for. So I am here in this special bonus episode welcoming back my good friend, Dr. Jenny Porter. Jenny, thank you so much for being here.
Thanks for having me again.
Yes, I'm so excited to learn so much from you, which, in our friendly conversations, I've already learned so much. That's why I want to bring you here for more ears to listen. But Jenny, just to remind you guys, she is a physical therapist who specializes in pelvic floor therapy. So Jenny, and I just want to say I lucked out in connecting with Jenny because I didn't know any of this. She just was like local to me, and we were chatting on the podcast, and like I said, I just got lucky because she is like specialized. She's got all the knowledge here. So can you explain, Jenny, how the training goes to become a physical therapist first?
Yes. So physical therapy, it is a doctorate degree. So there's two paths to become a physical therapist. You can do a 6-year freshman entry program. So you graduate as a senior from high school, you apply to the program to the university for your freshman year, and it's an integrated program. And by the end of your 6th year, you skip over a bachelor's degree, you go straight to your doctorate. Or the more traditional way is you do your bachelor's degree and then you apply to graduate school, and it's 3 years in graduate school. And then you'll get your doctorate after that.
And tell me about, because I know you have clinical education too.
Mm-hmm.
So how much clinical education is, and what I mean by that is you're actually like with patients, you're in hospitals, you're in outpatient, like different settings. What's required for
Yeah.
that?
The actual requirement, I'm not sure of the technical, like for a program to be certified, you do have to have so many hours within clinicals, which is, you're right, where you go and you work in the settings with patients and clients. And it has to be a variety, can't just be in one place your whole time. How a program structures it is really, really different. Some programs, like the one I graduated from, integrated clinicals throughout your entire 3-year process. So I did my first clinical at the end of my first year, and that was a 4-week stint. And then our largest ones were our 3rd year, and those were 8 weeks. Other programs save all of their clinicals for their last year. So it's more like 2 solid years of education and classroom, and then 1 entire year of just traveling for clinicals. Other programs will do clinicals throughout, but they're longer. So up to like 16 weeks per setting. And so it just depends on the individual program, but you do have to have them. And then that kind of sets you up for your experiences coming out as your own provider, because you really do learn a lot. If you put in the work as a student, then you really do learn a lot during the clinical
Yeah.
time.
So how much in your training to get your doctorate in physical therapy, is there any practice or education on pelvic floor physical therapy?
That's a good question. When I went through, so I graduated in 2016, and we had a 1 hour lecture from a pelvic floor therapist. And that was it. We technically, I think in anatomy, they said the words pelvic floor muscles, and they may have shown a slide for 30 seconds. So that was my first year introductions, about a 30-second said the word. Our 2nd year, we had a 1 hour lecture, and that's it. Other programs are getting better at incorporating it as an elective course. So some build in some times where you can pick and choose a specialty topic to learn more about. those programs typically will have a pelvic floor therapist on staff. And so, going into the program, whether or not that's going to be an option, but those are far and few in between. And
Okay,
so
so
for,
well, I just want to ask, so would you say that the I don't want to say basic because it's not basic. You're getting your doctorate, so nothing
but
basic about
still
it. But I mean, like
basic,
the new grad, I should say, as a physical
yeah,
therapist, would it's unlikely they would feel qualified to treat pelvic floor issues like
yeah.
extensively.
No, they are unqualified. They cannot
You're
come
like
into
they're
a
straight up
setting.
unqualified.
Straight up
Okay.
unqualified. All it does is in the core in school, they only treat you enough to knowledge wise know that exists and know the basic clinical reasoning through it, but you don't have any training in the skill set to actually do the treatment.
Okay, super helpful. Okay, so then
Mhm.
how does one become a pelvic floor physical therapist?
So all of that training is post-grad training. So as a physical therapist, like most other medical providers, we have to do what's called continuing education courses. So you have to have so many hours that's dictated by state to renew your license, just to show you are staying updated on the current data, research, and information, so that if you treat for many, many decades, you're not going to do harm by doing an old practice that's no longer acceptable. So pelvic floor training is part of those. There's two big companies in the United States that do this, well, and globally, but they're homed here. And they allow third-year students. So when you're in your final year of PT school, they allow them to come to the courses, even though they don't have their own license and they're not practicing physical therapist. And so that is one way, is as a student, if you want to come out and do pelvic floor therapy, taking a course your third year is how you hit the ground running, because that is how you get the certification and the training to start actually seeing patients in real.
Okay, so can you tell us about these different companies? Because I know, I mean, I was a PT, a physical therapist assistant for a while. I did continuing ed for several years. I know a lot of different other like jobs have continuing ed too, of course. So I think a lot of people kind of know how that works. But basically, just for those who aren't doing continuing ed, can you just explain a little bit what that means? Because that's not like there's not a pelvic floor PT school like this. We're talking about 3-hour trainings or 6-hour, like day-long trainings or week-long trainings. Can you explain that?
Yeah. Yes. So there are pelvic floor residencies now. So those residencies as a whole for physical therapy is newer. They are the standard for physicians. We all hear of physicians in residency. They are now becoming more popular for physical therapy as a whole. Pelvic floor therapy is present, but they're very sporadic and rare. And the majority of physical therapists, it's just, it's not feasible to pursue a residency when you graduate. So then most of us do these courses. There's two main companies, the American Physical Therapy Association, or APTA. They are our national board for physical therapy as a whole. And then they have subspecialties for all specialties that physical therapy can pursue, including pelvic floor. The other one is called Herman Wallace. They've been around a very long time, and they do specialize in pelvic floor and associated specialties like lymphedema, and things like that. And so those are the two main ones. And they typically have their courses structured on a 3-day schedule. There are some where they're 2 days, but the vast majority of them, it's 3-day intensives where you have to travel typically to go to the course. They're 8 to 10 hour days of both lecture and then what we call lab, which is where you're hands-on skill practicing and learning how to physically do what you're cognitively learning. And then at the end of it, you have to take a practical exam. So they test you on the skill set, and a written exam to make sure that you have retained the knowledge and that you're safe to continue practicing with patients once you get back to your home clinic.
I have written here Academy of Pelvic Health. Is that another one too?
So that
Or
is
is
the
that
specialty within the APTA.
I
So
see.
the
Okay.
American Physical Therapy Association divides it all up into academies. So you have Academy of
Gotcha.
Pelvic Health, Academy of Orthopedics,
I
Academy of
see. That's the
Lymphedema
branch of the
Center.
APTA. Okay, that makes sense. Okay,
Yes.
now I want to kind of understand though, like, so you mentioned Herman and Wallace, APTA, but there
Mhm.
are other organizations that can put together pelvic floor continuing eds, right? So, I mean,
Absolutely.
there's like a lot of other trainings that PTs can choose from, and they might learn some good techniques and things, but like what you're saying is that, can you explain what the difference is?
Yeah, absolutely. So yes, anyone can technically put together a training course and get it approved by the state as being applicable and safe and practical for physical therapists to learn the skill set. And the state can approve, the state board for physical therapy can approve that. But most people, most individuals or specialists who put together these courses are choosing very specialized topics. So, for example, dry needling of the pelvic floor implications for running athletes, pregnancy and postpartum considerations. They're more specific within the pelvic floor umbrella. And actually, I only know of two very small companies that I would not recommend you go to. Most companies rely on the APTA and Herman Wallace to teach the physical therapist the foundational skills and the foundational information, and then you can seek other companies for more specialized training if you so
Okay.
choose.
Yes. Okay. So I would say probably, and tell me if I'm wrong, the most common things that women are going to pelvic floor physical therapy are for, painful intercourse or sexual dysfunction of some kind and postpartum. Would those be the
Yep.
two kind of most common things? I mean, I know
Yes, and
that's
I
probably
would
a hard
say
question to
urinary
answer.
leakage would probably be the other hot
Yeah.
topic for women. Yes.
Okay, so how many classes would be in order for someone to be able to appropriately treat my sexual dysfunction?
Mhm.
How much training do they need from one of these courses?
So that's a good question. If it's one of the two main companies that we've mentioned, their classes are structured very similarly in terms of content. So there's 4 courses for your what I call your basic pelvic floor specialty. Your level 1 course is going to cover female urinary incontinence and basic pain, basic pelvic pain. And then there's 2 intermediate classes. One covers more advanced pain presentations, and the other one covers bowel, which includes male pelvic health. So it's bowel and male, and then more advanced pain and some other specialty diagnoses. And then your advanced course is your complicated presentations, neurological presentations, congenital implications, things like that, that are more rare and highly more specialized. And
Okay.
so for your basic uncomplicated pain with intercourse, I would say level 1 could be enough, but really taking that intermediate course to have the 2 underneath you, that's more that's what I would personally look for if I was looking for a physical therapist.
Excellent. And
Mhm.
then if you have the level 3, that's best. So if you're having like really complicated symptoms management, lots of issues going on, you really need to see someone who has had the level 3 training. Is that what I'm hearing?
Absolutely. And that will also play out. So it's not like you can't go to one course and then the next weekend you can turn around and do the next 3-day course, and the next weekend the next 3-day course. So there's so much information on in these courses for you to digest and then apply, that you have to space them out. And these 2 companies have a schedule that they recommend. Like, you don't take courses faster than 1 or 2 per year. And so they're a nice, easy screening tool for providers. How many years have you been practicing pelvic floor
Yes.
therapy? Because if they've been practicing 7 years, then they could have physically taken that number of courses. If they've only been practicing for 3 months, they physically can't have taken those high level courses.
Right. So the point is, it takes time to develop this skill, and understandably so.
Mhm.
And so we want to make sure that we're connecting with the right kind of therapist, because tell me, I mean, you kind of explained to me that this shocked me, that almost anyone, any physical therapist could kind of call themselves a pelvic floor physical therapist. There's not like a, can you explain that to me?
Yeah, it's unregulated. Like it's just a
Yeah, that's what I
term
was getting
that
at.
we use. It's there's no governing body. Like physical therapy, there's a standard. You have to have a degree, a graduate degree, and or even bachelor's. So you have to have a degree in physical therapy and you have to pass the boards to call yourself a physical therapist. There isn't the same standard for pelvic floor. They're working on creating this, but it's going to take a long time until
Yeah,
that's established and then accepted within the
right.
community. And so I have met pelvic health therapists, is what they call themselves, who only treat the bony pelvis. So, like your SI joints, the low back, the pubic symphysis. They don't know anything about the soft tissue of the pelvic floor. I've met pelvic health therapists who say they treat the pelvic floor muscles, but they only do externally, and the only internal work is a very specific maneuver rectally for the coccyx or for something very, very minor specific because they learned the
That's what I
one
learned
skill
as a
set.
PTA. I learned that as a PTA even. So that's, it has to be super basic.
It is super
Yeah.
basic. Exactly. And it's one of those things we call them pearls of wisdom. Like you can just pick up from someone that can show you the skill and then you can call yourself a pelvic health therapist. And so it is more old school to use the term pelvic floor therapy or pelvic floor physical therapist. It's more accepted to say pelvic health because it is more inclusive. I don't just treat the musculature of the pelvic floor. I do have the knowledge and the ability to treat the bones, the connective tissue, etc. But it separates out that I do have this specialized training that I think is important that does get lost in some of this nuance.
Yeah, and just as a patient myself who had like so many years of painful intercourse, I can tell how complicated it is down there. Like there is a lot. It really is its whole branch, is what it seems like. So you want somebody who is very experienced and really knows what they're doing. And that's the purpose of this episode. And I want to say, like, it doesn't mean that these other therapists who haven't gone through all the trainings and all the levels and the Herman and Wallace and APTA, doesn't mean that they can't be very good therapists. That's not the point. It doesn't mean that they can't pick up very good skills and develop, develop skills that are very helpful to people. We just want you to understand what you're getting for who you're going to. I want to rewind really quick because we talked about level 1 training, level 2 training, and level 3. I was kind of like just vague and I said complicated issues. Can you give some specific issues that may fall under the kind of symptoms that you'd be dealing with that you would need a therapist who had the level 3 training?
Yeah. So if you have any kind of neurological disorder, any significant neurological disorder. So for example, like muscular sclerosis, MS, that's pretty common. And especially in the earlier stages, it's a predictable pattern. Later stages, it might be a different story, but more like a traumatic brain injury, a spinal cord injury, a paraplegic, something like that. That's your level 3 training where we get into a lot of details, and it's a very different approach because they don't have the same neurological function throughout the body that you're taught in the beginner and intermediate courses. And that's true of like congenital malformalities. So if you're born without certain things, or if you're born, just however it may be.
That helps.
Yeah.
Okay.
That'll all be in your advanced training. So very, very specific.
Okay, now another golden question. Does a physical therapist, a pelvic floor physical therapist who has done the level 2 training,
Mhm.
are they equally equipped to treat someone with sexual dysfunction as they are to treat someone postpartum?
Ooh, that's a really, really good question. So I should have specified that in those two main courses, they actually do separate out pelvic floor and pregnancy and postpartum set. So there's actually their own track. Pelvic floor is 4 courses. Pregnancy and postpartum is 3 or 4 courses, depending on the company. They overlap quite a bit just from the nature of delivery, whether it's vaginal or cesarean, but they are distinct. So I would personally argue, no, I have done the training for both. And so what I learned in the pregnancy and postpartum would never translate, will not directly translate to treating someone with, for example, like vaginismus or bowel dysfunction. And your level 1 pelvic floor course would never equip you for how to coach someone through the physical delivery process of the baby descending through the birth canal.
Yes. So again, this is why I wanted to talk to you about this, because I mean, I think it's totally normal for someone to see, oh, pelvic floor physical therapists, they are naturally equipped to treat whether I have postpartum sexual dysfunction, bowel issues, urinary, like it's all across, and it's just not that simple, right?
It's not. I
Okay,
know. It's not
great.
that simple. We would think small area, not a lot going on. It seems straightforward. When physical therapy, you graduate being able to treat head to toe.
Right.
But there's a lot that happens. Man, oh man, it's a busy area.
Oh yeah, and again, and I mean, like I said, I was a pelvic, I'm sorry, I was not a pelvic floor. It's so many P's. I keep T's and all
It's
the
a lot.
things.
Mm-hmm.
A PTA, physical therapist assistant, almost said it again. For 6 years, I too had 1 hour of training on pelvic floor physical therapy. And it was such a different animal for me. I was like, nope, like there is not even close to like the whole body as I did orthopedics and like and post-op. Different animal. Completely different animal. Okay, so real quick. Okay. Now we just explained all the training that physical therapists go to become pelvic floor physical therapists. And I think a lot of women are probably and naturally wondering, well, that's great, but how the heck am I going to find out what kind of training this Joe Schmo over here in the physical therapy office is to know if this is like, so tell me, as someone who practices, how can I go about learning about the physical therapists who are local to me if they're equipped? Is it really
Absolutely.
weird to call the office and be like, can you tell me about this?
And it can get a little sticky because it does take time, because I'll do this if I'm seeing someone and they're moving across country and I know they need to continue because we've done work but they're not done. I will interview to make sure they're not going to waste their time, or worse, regress from what we've already improved upon. So I do have some interview questions. And normally when you call a phone number, you're not going to get the physical therapist answering the phone. Some clinics you do, but that's not often. So you're going to talk to a receptionist or an assistant or something who isn't going to know the personal bio for every therapist in the office. And so it's fine if you leave a list of questions and they can give it to the therapist to either tell that assistant to then call you, or the therapist themselves can call you. So my interview questions are, first and foremost, does the physical therapist do internal examinations? And it's not that you need an internal exam. We've talked about this in past podcasts. There's many ways to do exam and treatments without internal. However, it does differentiate what I was saying earlier of this, how I call myself a pelvic floor therapist versus a pelvic health therapist. They do have that advanced training in that they could do it if it is required or if it's indicated. So that's my first screening question. The next one I usually ask is, what kind of patients or clients do they normally see? So everywhere I've worked, they always know that I see men, women, and children for all diagnoses. And so that is they would be able to answer that question because they're the ones assisting to schedule. And so that's another easy question that they should be able to answer. And then my next set of questions
Wait,
gets a
before you
little,
move on, I had
yeah.
this note when I spoke to you earlier. You mentioned if they only treat women for urinary incontinence,
Mm.
then it's probably not a good fit. Just as an example of a response that you might get, right?
It may not be a good fit if paired with the next question, because that usually implies they took the level 1 course. Now, you could have only taken the level 1 course and been practicing in pelvic floor therapy for 2 years. So you are really good at what you know. And they may be skilled enough because of now their experience to be able to treat the pelvic pain and pain with intercourse. But if they just started the program 3 weeks ago because they just got back from taking their training, that may not be the best fit.
Yes.
Mhm.
Okay. So
So then the next question is, how long have they been practicing pelvic floor therapy? And I separate that out from physical therapy, because you could be
nice. So
practicing.
make sure you specify.
Make sure you specify. You
Gotcha.
could be a 20-year physical therapist who just got involved with pelvic floor therapy 6 months ago.
Yes. Oh, such good questions. Okay, Jenny, be honest with me. I mean, as a pelvic floor physical therapist, if someone called and asked you what company did you get trained in, would that like offend you?
No, not at all.
Okay.
It's all basic. It's all knowledge. So I did almost all of my training through the APTA, and they have a track called CAP Pelvic, which is the pelvic floor courses. And then they have a track called CAP OB, and that's the pregnancy and postpartum courses. So I completed both of those tracks. And then I also have done many of their more specialty topic training courses. I did take one course when I was my first year as a graduate. I took one course through Herman and Wallace just to compare their education styles, and just my style of learning lined up better with APTA. I have the course manual and I compared them side by side. The information is very similar, but the way they present the information and teach it is very different. And so for me, APTA was a better fit.
Right. Great information. So, okay, now not everybody has someone locally, unfortunately. Like this is great and all, but it may be really hard for some women to connect with the right kind of pelvic floor physical therapist. So if they don't know or they don't have access to someone with the appropriate training locally, do you have any recommendations or suggestions for them?
Absolutely. So first and foremost, there was many challenges with COVID and the quarantine, but one of the beautiful things that came of it was telehealth and electronic physical therapy services. And those have become more accessible, especially in the private settings and in the hospital settings. And so that would be my first recommendation is if you can't find someone local who's either appropriate or just isn't a good fit. Like you went to them, they have all the credentialing, but man, personality wise, you are just not lining up at all. Then look for someone who you love nationally who has telehealth, and you can do electronic visits.
So how do you find someone you love nationally?
That's a great question. Google is a great place to start.
Just Google. Okay, I see.
Google. So one, Googling it, because you can kind of specify some of your search parameters. Google reviews are phenomenal. Those are verified well in their patient reports. So look at satisfaction rates and things like that. And then I'm pretty old school. I start calling, and I don't email often because I find I get a less response because therapists are usually busy with clients, but I get on the phone and I start calling the ones who I screen them from their website and their bios. And then I call the ones that look promising.
Oh my gosh, this is such amazing information. Jenny, thank you so much for being here with us again today and sharing all of your knowledge. If you guys missed our first, I think we have 3 episodes now on pelvic floor physical therapy, make sure you go back and listen to those. And if you are in the market, or you know someone in the market, share this episode with your friends to help make sure they get the care that they deserve. Y'all take care.